everybody. I'm Beatty and welcome again, my friends, to the Ask Beatty Show. And we are going into year number 12. It's absolutely amazing. When I first met Dr. Gary Null here in New York City, and 12 years later, the Ask Beatty Show has actually, there have been, well, hundreds and hundreds of shows. And again, I want to thank you all so much for your comments and calling in and the discussions that we've had over the years. And for those of you who may be tuning in for the very first time and you're wondering, well, who is Beatty Cohn-Frennis and what is this Ask Beatty Show really all about? Well, I am a psychotherapist, yes, one of those, and also a sex therapist, and I am the author of a groundbreaking book on relationships for better, for worse, forever. Discover the path to lasting love. And I say this all the time. I only wish that I had had this book when I was starting out in my own dating and relationship life. About the book, I actually did research with 450 people in the Boston, Providence, and Connecticut area. And as a result of the research, I came up with a 10-step formula. Yes, a formula that actually teaches us all how to assess. I know it's not sexy, it's not romantic, but it's really critical. How to assess who's right for us and who's wrong for us before committing to any serious relationship, because the formula, it really changes. It changes the way that we look at relationships forever. And I say this to my patients all the time. I have a private practice here in New York City and also in East Hampton. And before I did the work, and I mean, I'd really like to think of myself as a very warm, spontaneous kind of person. I would meet somebody, I'd meet a man, I'd meet a woman, and, I'd say something like, well, I met this really nice person. I would never, ever, 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 ever make that kind of a comment today. So I'll say to people, so, okay, so what would I say? Well, the very, very best that we can say when we're meeting people for the very first time is that we've met somebody who appears. They appear to be nice. They appear to be smart. They appear to be honest. And the thing that was so interesting about the research, and for me, it was really disappointing because in my personal life, I'm probably one of the most impatient people that you will ever want to meet. And of course, professionally, I am extraordinarily patient. But what my research found was that it takes about a year using the formula to really find out who somebody is and isn't. And we really cannot fast forward this process. And of course, if we're seeing a lot of red flags, you don't stay in for the year. But I really identified, and this is something that I hope that you're really going to take in for yourself in all of your relationships, whether you're talking about romance or whether or not you're talking about collegial or business relationships, that there's three things that we all need to do especially if we're talking about love, if we never want to make a mistake in love again. And that is the name of my program, Never Make a Mistake in Love Again. So number one, each of us needs to be in a good place ourselves, emotionally and psychologically and psychiatrically. And we have to work out as best as we can, even though we can't change history, the things that did and didn't happen in our life that impact our mood, that impact our life just overall. And this is a process. This step, I know that it's not fun for a lot of people to do, and yet it is critical. And number two, we all need to get a lot more clarity when it comes to what are the ingredients that really and truly go into the making of a healthy relationship, because we all really want healthy relationships, right? And then number three is the formula. And every single week, I'm citing the statistics with all the self-help books and the therapists and the coaches and the talk about relationships and mental health. I mean, look at the reality, everyone, of what we are doing. We are seeing a divorce rate of 48 to 50% for first marriages. And people say, okay, well, do people in second marriages, do they do better? Well, no, they don't do better. They do a lot worse, because the divorce rate for second marriages is 67%. And then I'll say, as I say to you, well, what about third marriages? What about fourth marriages? Have we learned anything about ourselves and about the dynamics and relationships that we've had in the past that haven't worked? Well, the divorce rate, just listen to this. The divorce rate for third marriages is between 71 and 73%. And of course, I'm always talking about lessons to be learned. What have we learned? Whether or not we're talking about business, whether or not we're talking about relationships. So, the point of my doing the show, I mean, I've done a lot of call-in counseling Ask Beatty shows on networks and on television, but the point of this Ask Beatty show here on the Progressive Radio Network is really to educate and to empower you, and above all, to keep you safe. So naturally, as the psychotherapist and sex therapist, we talk about mental health issues and relationships and sexuality, and how and what to do, not just to think, not just to dream, not just to talk, but what are the things that we really have to do to maximize our physical and emotional well-being, despite the stresses of life that we all have to deal with. So I have a mantra, and it's a mantra that I've hoped that you would incorporate into your own life. And that mantra is acknowledge and address and resolve as best as we can, even though we can't change our history, the things that continue to get in the way of our life, the things that continue to really prevent us from living a joyful and happy life. And one of the things that I hope that I have been able to convince you over the years is that we don't need to navigate this journey on our own. And if you're lucky, you have friends and supportive family. But if you're finding that the supportive friends and family, despite the fact that they may really want to help, that's not quite doing the trick, I hope that you will give yourself permission to reach out and get good professional help. And let me just underscore good, because all professions, whether we're talking about mental health, whether we're talking about physical health, this is another thing that I find myself saying a lot, is that we have to be very, very careful who we let into our lives. And also a reminder, this is something, again, I hope that you're really going to seriously take in, a reminder to say no to the things and the people and the places that steal our joy. Really important to set these kinds of boundaries. And, again, a little bit of toxicity, a little bit of poison. Someone will say, well, he only hits me once a year, or things only get bad, every couple of months. And my point about toxicity is that poison is poison. And a little bit of poison will kill you, whether you have a lot of poison, whether you have a little bit of poison. So the object of the exercise in our lives, hopefully, is to eliminate poisonous people, poisonous places, poisonous foods. But I have a really special guest today, and I met Dr. John G. Kennedy, who is an orthopedic surgeon with NYU Langone Health and an expert in foot and ankle procedures and regenerative medicine. He was a panelist on a panel that I chaired a couple of weeks ago at the Three Tomatoes Summit on alternative medicine. And I have to say that before I was reading some of Dr. Kennedy's work, I knew basically nothing about regenerative medicine. So we're going to learn a lot today. And Dr. Kennedy, I'm so happy to see you. Wish I was seeing you in person at the studio, but we will do that another time. And thank you so, so much for taking the time to be here with me and really to educate my audience. So welcome.
Thank you so much, Beatty. It's a terrific pleasure and a great honor to be here with you. And I'm looking forward to this.
Well, okay, so let's start off. What exactly is regenerative medicine?
Yeah, it's good to sort of preface this by regenerative medicine is one of those aspects in current healthcare, in Western healthcare, that is the fastest growing um, aspect, if you like, in the healthcare sector. So we really need to define what it is, because we can oftentimes be misled. You talked earlier on about be careful who we let into our lives. So I think when we're looking at regenerative medicine, let's come up with a really good definition and then define the people that are actually competent to do this. So it really is to regrow, repair or replace damaged cells, tissues, or organs within the body, and it can come from ourselves, or we can get the ability to do that from other people, from grafts, or we can get it from recombinant proteins and things that industry make for us. But again, it's to underscore that regenerative medicine is this fastest growing. It's going to be a $30 billion industry by the end of 2030. That's an enormous amount of money. And so we have to be really careful that we know where to use it, how to use it. And in certain cases, we also have to know who should not be using it, both in terms of the doctors who are selling it, or indeed the patients who are using it. So again, we've got to put in a lot of checks and balances into regenerative medicine.
Right. So, for example, who is a good candidate? I mean, you hear people all the time, they're complaining of aches and pains in shoulders and hands and knees and feet. Who are the people that should be seriously considering regenerative medicine? Should they go to a traditional orthopedic person, initially? And then how do they get on a path to seriously considering regenerative medicine as an option to surgeries and all kinds of invasive procedures?
Yeah, and that's the great question, because I think honestly, every single one of us, whether in New York or wherever we're from, we're all over time. It's like wear and tear. It's just the same as a car. We bring it in for a service every so often, and if we don't bring it in for a service, something will break, and then it'll require something much greater. So it's the same with the human body. We're constantly breaking down and regenerating, but at a certain point, for instance, with arthritis, whether it be your knees or your shoulders or your ankles, we can't cure arthritis, but what we can do is we can slow it down. So if we ignore the pains in our knees or ankles and we say, oh, it'll be fine, I'll get a knee replacement by the time I'm 60, well,
Right.
that's not a great strategy. So if you start to get pain in your knee, don't wait, because if you come in and you get an MRI or an X-ray followed by an MRI, we'll see if there's early arthritic change. Then that's the perfect person, the perfect pathology to have something injected that will slow down the rate of destruction of the joint and reduce inflammation and give them symptomatic relief. And we can't stop arthritis, but we can certainly slow it down to a point that we're not going to need replacements as much as we have been in the past.
It's so
But
interesting. And, with many, many people that I know, and of course, I'm a competitive tennis player, there are knee issues and there are wrist issues. And I hear all the time at my clubs, people are getting cortisone shots. Now, you're not talking about cortisone shots, right?
no, so cortisone is a steroid,
Yes.
and it's a very, we used to think cortisone wasn't a great thing because it could damage cartilage, but in the early stages of arthritis, cortisone is a useful thing because it'll turn off all that inflammation that's causing the destruction of the joint. But you can't get cortisone all day, every day. You can only really, we recommend you probably only get 2 or 3 shots a year. And
Mhm.
remember that cortisone is almost like a band-aid. It really just stops the inflammation, and it makes the patient feel better, so it reduces their symptoms, but it doesn't really slow down the process to any appreciable level. By contrast, if we take blood from you and we spin that blood out, we take our platelets, which are these little cells that are packets of growth factors, a very powerful anti-inflammatory, and we inject that into your knee or ankle or wherever, that will do the same thing as a steroid. It'll turn off all that inflammation. but it
Mhm.
also has these things called trophic effects. So it is immune modulatory. And really that sort of fancy word means it starts turning off all the processes that cause the self-destruction of our joints. And all that does is it prolongs the life of their joint, and it gives us symptomatic relief. And when you look at this in terms of head-to-head comparisons, when you look at studies that are out there, they have to be good quality and good level studies. And you look, how does steroid compare, let's say, to PRP?
Right.
Well, PRP in pretty much every instance outperforms a steroid, and it will do you no harm. And you can get unlimited injections of this. So I think that's the difference. You know, the regenerative aspect of it. PRP is a regenerative process, whereas a steroid is really more of an anti-inflammatory. It'll get rid of some of the symptoms for a short period of time. So think of it almost like a Band-Aid, where
Right.
regenerative medicine is trying to regenerate and repair some of the processes that are going wrong.
So can these treatments be used for basically, I mean, not the heart, I would guess, but I mean, for basically most or kinds of, you know, orthopedic kinds of issues, or do the treatments go beyond? I mean, are we talking the ankles, the shoulders, the hands, the wrists? Are we talking about other parts of our body as
Yeah,
well?
you know, that's so interesting because my area of expertise, if you like, is just in musculoskeletal conditions.
Right.
But there's such great crosstalk between what we do and the dermatologists do and the neurologists and cardiologists and so forth, because regenerative medicine is not just specific to the skeletal structure. It's the whole body now has a capacity that we can regenerate to some degree
Uh-huh.
the cells that are being broken down all the time. And so that's what's really exciting. You know, it's I think, you know, we had a good chat at the Three Tomato Institute meeting, and we talked about traditional or Western medicine
Yes.
and how it really has kind of, you know, gets in a rut. We've been doing the same thing for 300 years, and we keep on reinventing the mousetrap with different types of metals and different plastics for joint replacement. And for many years, we've been ignoring the Eastern medicine, which was always about regenerating, repairing ourselves. We have that ability. We are constantly regenerating and repairing ourselves. And we just need to turn that on in specific areas to be able to do that. And if we can augment that with injections, you know, taking blood from us, taking fat cells, taking marrow, and then putting them into joints or putting them even into tendinous areas or even wherever it is. And then we have the ability to upgrade that regeneration and repair it, to really supercharge it. That's what we're talking about.
Mhm.
So I think that we have a lot to learn from the Eastern medicine, and I think we're on that cusp where we're recognizing Western medicine is very, very important, but it's not the be all and end all. And we
Right.
talked about sort of this holistic approach where regenerative medicine, I can inject a PRP injection into your knee tomorrow, but if you have all the stresses of your job and you have all the other things,
Right.
it's not really going to do very much good, you know,
Uh-huh.
or at least it won't do as much good as if you can address the other things in your life that are causing this stress. And I think when we look at arthritis, for instance, this is really an immune system derangement. It's ourselves breaking down ourselves. And of course, stress makes it
Yes.
worse, makes it a lot worse. So the things you alluded to earlier on, how do we take our this holistic approach to our dating life or whatever it is?
Right.
That's so important in what I do as well. So it's not just, you know, come in and have an injection and off you go. And you know, it is what are the other things that are going on in your life that cause this? And that's where we're able to collaborate with our colleagues and refer them to psychologists, refer them to other people who are experts in the field like yourself, because those things all need to be in balance. Whatever I do, whether it be in the operating room or whether it be in the clinic with injections, it's only good insofar as it goes. It needs all the other things to be in balance to really get the end result we're looking for.
Right. I mean, do you find that more and more, of course, in your collegial world, I would guess you're kind of hanging out with people who have bought into, this way of looking at health and medicine. But are you finding that more and more doctors are actually open to this? When I think about this, nobody has ever, luckily I'm very healthy, but nobody's ever asked me about my stress. Nobody's ever asked me about my marriage. Thank God it's good. Nobody's ever asked me about my sex life. You go in, you have if you're lucky, a 25-minute physical, goodbye, and that's the end of it. So is the medical profession really starting to pause and open to really looking at a more systemic way, Eastern medicine, Western medicine, in terms of treatment for people? Because I'll tell you something, Dr. Kennedy, at the summit, the people at the summit, highly educated, I mean, it was mostly women, highly educated women in various different fields. Nobody had ever really heard about much of what you were talking about. And we were so thrilled. We were so open to hearing that, when you have aches and pains, it's not going to be about going in to see a doctor and getting an injection or getting a prescription for an anti-inflammatory or for some sort of pill. I mean, we didn't know about this. So our colleagues, our doctors, open to, expanding their perspective on healing and health and medicine.
Yeah, it's such a tough question to ask, or to answer really, because I think those of us who are interested in regenerative medicine, I think that body of evidence, 10 years ago, we would have been thought as mavericks in this field. And now more and more and more traditional surgeons are using regenerative medicine as an adjunct to what they're
Really?
doing. And that's only going to increase. And as it increases, then insurance companies will recognize it as a way for them to save money, but obviously to avoid big surgeries and prolong the health of the patient. For them, that'll be important. For us, it's just the health of the patient. And so when you look at it in that way, it's going to take a little bit of time. But if you look at the average amount of time somebody who goes in to see their orthopedic surgeon with standard insurance, the metric is 7 minutes. Beyond 7 minutes,
Right, right.
you start, the actual business aspect of this starts to lose money. And for me, I come from Ireland originally. That's not how we practice medicine. I know from Canada, you're the same way. We can't do
Right,
it that way.
right.
And so for us, it was a decision. Do we get into that, or do we stick to our guns and let's, if it takes an hour, that's how long we spend with a patient. And so I'm not going to get into the ins and outs of your marriage or sex life or anything else. I'd be arrested. But what we do is, you start to get to know your patient. Many of my patients are friends now, and that's just the way it is, because you build up a personal relationship, and you start to learn about the things that are causing them stresses. And I wouldn't be in any position to address those, but
Right,
once you know of them, then you refer them to the right people who can. And I
right.
think that holistic approach, look, we're not, certainly I would never say that I'm the greatest surgeon in the world, but our outcomes of surgery are based on what we do in the operating room. And that's a very small percentage. I always tell people, whatever I do in the operating room takes me an hour or two. Then I go home and have my tea. The rest of it is up to you and all the village. We talked about this before. It
Yes,
takes a village to
yes.
really make the best, to get the greatest outcomes. And so I think that's where we're lucky that we have the ability to talk to patients, to understand where there are needs that within 7 minutes you simply can't find out. You won't remember the name of the patient within seven
Right.
minutes. And so I think that's where the Western medicine is pushing us to a conveyor belt type product. But I think you and your colleagues and so many of us now are taking a step back and going, that's not good enough. We need to look at things in a more holistic approach and be collaborative with all the fields that we have around us. And of course, in a university setting, that's so nice because we can refer very easily. But so for me, that's, in small part, an answer to your question. I think more and more doctors are now saying there's much more to what we do on a day-to-day basis than, hammering in nails and screws and plates and so forth. That's one part of it. The rest of it we have to address.
Well, it's so gratifying, of course, to hear you say this. And for people who are visiting orthopedic, surgeons and doctors, and are being prescribed the typical, the injections and the prescriptions and all of these things. I mean, it is a question of education. I never would have thought, let's say, if I had an injury, it wouldn't have dawned on me that, oh, well, there would have been an alternative way to try to heal. And I was going through some of my notes from the conference, and there's so many different treatments, beginning with PRP. And I want people to know, because I think in the media we hear a little bit about PRP, but what exactly is PRP?
Well, PRP is our own blood, and the great thing is that we're taking it from ourselves, so we can't do any harm. So we take blood from a vein in the arm, and then we take it, we spin that blood in a centrifuge, or just a very fast machine that sort of spins it out based on the weight of all the contents of that.
Right.
And from that, we take platelets, which are these little cells that have all these packets of growth factors. And then once we have those growth factors, then we can inject it back into the body, whether it be a tendon, whether it be or wherever is painful, and wherever we have good scientific evidence to show that it'll help. So when you look at the evidence, let's say we have so many patients come in that are runners, and
Right.
when they get pain in their Achilles, it can be so debilitating, and there's no good surgery for that, and neither should we operate on those patients. Typically, it's months and months and months of rehab. Whereas when we use PRP in this area, about 70 to 80% of the time, patients will get better within about 2 to 3 weeks. They'll start to show improvement, so they get into physiotherapy, and they're back to sports within 6 weeks rather than 6 months. So that's a major improvement. And when we look at that in terms of the clinical evidence, that's one thing, but then we do a deep dive into it, and we can see that PRP upregulates a gene within the tendon to produce lots of new tendon-like material. So there's a plethora of evidence out there. Now, 10 years ago, people would have said, oh, the evidence is not there.
Right.
I would suggest that those people are not reading enough now, because the evidence is there and it's mounting more and more. So you're having more traditional surgeons are now using this to avoid surgery, or as an augment during surgery to help repair things. Similarly, PRP, not just used in musculoskeletal system. I think we all heard the vampire facelift when the Kardashians put PRP on their face. Of course,
Yes.
it brings collagen to the surface. So it's one of these incredibly sort of chemoattractant products that it works. This is the great thing. It works. And if in all of this, it didn't work, it does no harm. And that's the most important thing in anything that we use. Again, I think you said that earlier on, be careful who we bring into our lives or who we entrust in our lives, and be careful what we use in our lives, that it too does no harm apart from the people. And so we know from PRP that there's no side effect. Every single drug we get from pharma, there's no such thing as any drug without an adverse drug reaction.
Right.
PRP has no adverse drug reaction because it's simply us. So it's us regenerating ourselves. That's all it is. So when we look at the evidence for that, let's say a knee arthritis, it'll give 18 months of sustained pain relief in even the highest grade arthritic joints. And that's great. So if you're a 60-year-old working in the city and you're told by your orthopedic surgeon, you're going to need a knee replacement,
Right.
and you may not be ready in terms of all the other factors that we talked about, the stress of that, in terms of, you've got a big deal coming up, or whatever it is in your life. If you're not squared away at home, you need time to organize for that. And you don't want to walk in, 3 days later when the surgeon suggests you have surgery. So you can have a PRP injection. It'll get rid of most of the pain. It'll prolong the life of the joint. And it has none of the adverse effects that a steroid would have, which we don't recommend before surgery. So in answer again to your question, who should be asking for this? We should all be asking for it. Okay. If you went to your surgeon and they said, well, you need this big surgery, then ask, is there an alternative that it may not solve the problem completely, but it will buy me time to get all the other things in my life organized so that I'll have the best outcomes from surgery.
Now, in New York City, I mean, there's people listening to the show around the world, but in New York City, what percentage of orthopedic doctor types would say to a patient who's coming in with various different pains and aches, there are a number of alternative regenerative therapies that I would like to recommend to you before even having a conversation about a knee replacement or some type of surgical procedure. What percentage? What are we talking about here?
Yeah, I loved and was frightened by your data on second and third marriages. As you were, and that's really hard data for this question. There is no hard data, but what there is, um, I would say that 10 years ago, less than 10% of orthopedic surgeons were using this, and they had a particular interest in basic science. And if you look at the equine veterinarian world, it's probably 100% in racehorses. That's where we get a lot of our data from that. And
Really?
we're a little bit slow behind that. So maybe 10 years ago, 10% of orthopedic surgeons looking after humans were involved in this. And now the likelihood is that's probably around 50%. And we're closing that gap more and more and more. And it's because there's good high level and high quality evidence showing both in basic science and clinical evidence that this works. But it's one of those things, when you have a hammer, everything looks like a nail. And so you have to be careful of the orthopedic surgeon. You go in and you say, well, I can give you all these 17 different injections over the next 6 months, and that'll cost you your house. You've got to be very careful of that. Everything we do has to be validated, and the data must be there to support it. And you raise a very good question. You've got to be very careful of who's giving you the advice that you need an injection.
Yeah.
There are 400 regenerative centers in New York City alone, 400.
Really?
And probably less than 10 of those have any scientific oversight.
Wow. I mean, that's so frightening. And, Dr. Butler and we had this discussion, before we did our panel a couple of weeks ago. And I was aghast to hear that. So 400 bogus regenerative centers that I'm sure people go to, and I would assume it costs. That was something that I wanted to ask you. I mean, does insurance cover any of this, or are all of these procedures out-of-pocket procedures?
So insurance is beginning to cover more and more, but we use some fat cell therapies that we take fat from the abdomen, and again we process that and known as micronized adipose tissue, and we inject that. That's even better than PRP or marrow into the knee or ankle. And insurance does cover some of that. Sometimes it covers PRP, and it's slightly it's different across the spectrum of insurance coverage, but the biggest problem is that many of these regenerative centers they have very good glossy advertising. You go online and you put stem cell treatments for, let's say, for knee arthritis, and we all do this now. We kind of shop on Google to see who is the best, and of course you can pay to be on the first Google page. And then it looks very fancy, and you see wonderful pictures of New York skyline, and you think, well, this is where I'm going to go. And then we did a little bit of investigative journalism, if you like, and our fellow James, who you met, went to these places, and they're on top of a laundromat, or they're and not the location is everything, but they're really not the place that they advertise to be. And much more importantly, the products they advertise are not real. Because if you're giving PRP, again, we know that it'll do no harm, but if you're saying that there are stem cells in PRP, then you're not advertising properly, because there are no real stem cells in PRP. And this is where the state's attorney general now is looking into this in terms of false advertising. And that's why we have to be really rigorous. So if your listeners are thinking, this is something I'd like to have, well, ask your surgeon, and most surgeons are very thoughtful and careful about what they're offering. And don't just go to a regenerative center, because the regenerative centers are oftentimes run by people who may not be have entirely your best interests at heart, or maybe selling you a bill of goods that's not entirely truthful. And so, case in point, and I think I can say this now, is Livion was using amniotic or cord blood, and this was a big case that it was a multi-billion-dollar settlement, I think, because they were advertising a quarter placental material, and it wasn't being processed properly. It was false advertising, and it wasn't entirely without complications. And so that's taking an allograft or somebody else's material, processing it, and then injecting it into ourselves. So, and then another a very elegant study out of Cornell looked at all the claims, because amniotic fluid is being used, or amniotic type membranes are being used. And they looked at the claims that there were growth factors and stem cells in this. And this was a multi-center study looking at 9 different products. Not one of those products had stem cells, not one.
Yeah.
And not one of them had anything above physiological levels of growth factors. So again, if it's packaged nicely and it's a glossy thing, you kind of go in and again, it's one thing that we talked about in relationships. And when you have a relationship with your physician or doctor, it's a true relationship. It's based on trust.
Yes.
And we all go into like you meet your pilot, you trust that he can fly the plane, or she can fly the plane. When you meet your doctor, you trust that they're doing the right thing based on scientific evidence. But oftentimes, we call them the back of the brochure scientists. They read the back of the brochure, it seems very glossy, and then they believe in it. But that's why I'm saying, be careful. When you're going to your orthopedic surgeon, make sure obviously that they're credible, and then ask for the evidence. And that's where it is. It's like anything in life. And you believe in data, so do I. There needs to be data behind this. If your orthopedic surgeon says, I can inject this, what's the evidence? That's all you need to ask them. What's the evidence? If they don't have the evidence, then you need to walk out.
See, a consumer would never, and this is why this kind of a show is so important, and I'm thinking about too, I'm the advice columnist, of course, sex, love, romance, relationships for, dance papers in the Hamptons and Palm Beach. And there's a huge, readership. We really have to do something, John, because I know that people don't know. I hear about, all the injections that people are getting, from my tennis world. And we're simply out of the loop. We would not even think to ask the questions. And it's kind of like in the world of mental health. I mean, there's so many therapists and coaches and really a lot of substandard people who not only don't have the credentials, even if they have their credentials. I mean, I'm very vocal. I have a lot of problems with American mental health. And again, it's about educating the consumer so that we're not going to end up, doing harm to ourselves because we simply don't know. We don't know what to ask. We don't know who to trust. I mean, when you talk about 300 centers, 300 in quotes, regenerative, therapy centers in New York, and there are 10 that are kosher, there are 10 that are really the real deal. I mean, that is frightening. So people are going to 300 centers. 300 centers are making tons and tons of money. And people are really, they're being harmed.
And the other thing is they're being harmed in various ways, because if you consider they're going there and they think they're getting stem cells, that's one thing. And the problem is that if they're being charged $20,000 for something, and then they leave there and they tell everybody, well, I had this PRP and I had 3 injections over the space of 2 or 3 weeks, and then because we get these patients coming to us and they said, no, I've already had stem cell treatment, it didn't work. Well, you didn't have stem cell treatment because you didn't have that there. And there's no evidence that 3 injections is better than 1. It's like a cup of tea. 1 teaspoon of sugar is probably good, but 3 is not. And so, when you look at how they cumulatively say, well, if PRP doesn't work, then we got to go on to this next treatment. And by the way, I'll fly you off to the Cayman Islands where we have a stem cell farm out there.
Yes,
And then you just
yes,
go, this is crazy. You know, we got to call a stop to the madness, because all the good that's being done by really rigorous scientific studies, by rigorous clinical work, is being ruined by people who are less than good actors in this space. So
right,
that's why, I'm very proud to be part of NYU Langone. It's we pride ourselves on, there's nothing here that we're using that hasn't gone through scientific rigor. And so we do a lot of the work ourselves. We've done a lot of the basic science work ourselves. We do a lot of the clinical trials ourselves. So there won't be a surgeon here, and we have 165 orthopedic surgeons. Not all of them are going to offer you regenerative medicine, but many, many will. And those that will know about it. They'll know the data, because so much of the data has been mined and harvested here. And I think that's so important. So wherever you are, whomever you're going to see about your MSK problem, this is an alternative that most orthopedic surgeons should know about. And if they do, and they're offering you something, just ask them for the data. That's all it is. And once you have the data, then you can go back, and we all Google now. We can all look at it to verify it. And,
right.
trust with verification. So make sure that that data is real, and then you can go for it.
Right, buyer, buyer beware. I'm looking at one of your articles that you wrote. Again, I knew nothing about really any of this until I was preparing for our panel. So concentrated bone marrow aspirate, CBMA. Now, this is another treatment that you would consider as an option, as an adjunct to the PRP.
Yeah, and it's quite a mouthful, isn't it? CBMA. But all it really means is that we put a little needle into the pelvic bone, and we take out marrow. And the difference between PRP and CBMA is that CBMA does have stem cells. And it also has this super powerful anti-inflammatory called IRAP. And this is the most potent anti-inflammatory. So IRAP goes into a joint or into an area, and it starts mopping up all these inflammatory cells. So it's a very, very potent anti-inflammatory. So that gives you the symptomatic relief, and the stem cells are important in producing this immune response and these trophic effects to rebuild, regenerate, and repair. So CBMA is slightly different. We don't do that in the office. We do that in an operating room. But there's no incision or anything. It's just a needle. It can be uncomfortable for a patient to have this drawn. So that's been shown to be really, really good for cartilage or the lining of the joint. It's been really, really effective there to prolong the life of cartilage. And in fact, restore, when you've small little defects, CBMA will actually grow cartilage-like material in there. So that's really, really important.
No, it's amazing all the things that we need to learn about, whether we're talking about finances or relationships or sexuality or orthopedics. I mean, it goes on and on. And of course, everybody is trying to sell you something so that that's so difficult to be able to decipher, the good, the bad, the ugly, the evidence-based, the bogus. I mean, it's very challenging.
Well, I would say anyone who's listening who's been recommended that they should fly to the Caribbean for stem cell therapy should probably save their money, have a good bottle of wine, and search the internet for real treatments. There's so much nonsense been peddled in this space, and it is
Unbelievable. Yeah. Well, I have a couple of very personal questions. Concrete surfaces. Yesterday, I was in Riverside Park. We live right on the park, and I wanted to play paddleball. And again, I'm a competitive tennis player, played all my life, and I was wondering how safe it was going to be for me and all the people that were playing paddleball on really hard concrete surfaces. Yes or no?
I would say yes, with a caveat that you need to be wearing a sneaker that will absorb mechanical load. So you have to be careful what you're wearing on your feet. and then you can play on a hard surface, yes. But it's better to have a sneaker that has some give in it, in the sole.
Any recommendations?
Well, there's lots of them. You know, years ago there were only a few.
Uh-huh.
I have to, I guess, be careful what I say on public radio and so forth. But yeah, there's so many good ones out there. And again, when you go to these companies, you know, to your shoe store, there's a lot of good pedorthists in there, and they're the folks that will tell you, you know, what's a good one for your particular the shape of your foot and so forth. Because all of us have slightly different mechanical alignments of our feet. So you don't want to go in and just get the same sneaker. You want to go in and make sure that your alignment is being helped by the particular type of sneaker that you wear.
So people have to do their homework as far as that goes too. And what about, somebody was asking me, because I told them you were going to be on the show, flip-flops, yes or no?
Same answer. You know,
Same.
we love our flip-flops, and you know, it's actually pretty good to wear flip-flops because it exercises the intrinsic muscles, the muscles we're not normally using. So you have to stay in a flip-flop, you have to use your toes to grip. And when you do that, you actually exercise your intrinsic muscles. So not bad, but I wouldn't go on a 4 mile hike in flip-flops. Flip-flops should be, you know, going down to the beach or just wandering around on the boardwalk. I wouldn't do any long walks on those. And again, in part because the mechanical alignment of our foot is not in any way supported by a flip-flop. So we have to be careful. Those with a higher arch, really not a good thing because you get ankle instability. You're likely to roll in a flip-flop. Those with a low arch, you're putting too much pressure on your posterior tibial tendon. It has to do too much work to get you propelling forward. So good in moderation, like everything in life, you know, good in moderation.
Right. Now, what are your thoughts about, kind of the do's and don'ts of keeping our joints healthy? For example, are you a believer in all the supplements that are being advertised? The magic formulas that will keep us forever young and limber.
And again, I would say buyer beware. Many years ago, there was a very good study done by one of the large military institutions, and they looked at glucosamine and chondroitin sulfate
Yeah,
uh, as a as a as an adjunct to health or joint care treatment. And the best that they could say is that it will do you no harm. There
that's
was
it.
that was it. There was no good evidence. And plus, when you looked at the availability of these products, there was such heterogeneity across what was available when you go into your nutrition store in terms of what was in these. And again, it's one of those things. The FDA does a great job on many of the things. It actually regulates the industry in regenerative medicine in terms of what we can use. This thing called a 501 or 401k predicate. And what that does is we can't use something unless it has an equivalence in blood or marrow, whatever. The problem is in all of these supplements industry, there's no great FDA regulation in this. It's almost it self-regulates, and it does so. You know, many of them are good products, many of them are not. And so again, and it doesn't necessarily. We always think, oh well, if I pay more, it's
Right.
probably better, but that may not be the case. So again, buyer beware. I would say chondroitin and glucosamine. It will do you no harm other than your wallet.
That is so interesting because it's those two supplements, I mean, they're continually being pushed,
Yeah, yeah, yeah.
as magic pills.
Yeah, and you look at all the like you can get it from a shark. I mean, I don't know whoever thought that was going to do us any more benefit than our own, but no, there's no benefit to that we know of, and there may be subtle benefits, and there may even be a placebo effect, but we certainly there's no empirical scientific evidence that those products in of themselves do us any good.
So interesting. So let me ask you this, is where I can't even believe what the time is, Dr. Kennedy. It's 3:52. It's like, we could talk forever. But after a patient goes in for a diagnostic assessment because of joint, issues, um, should regenerative therapy, and I think you said it, but I think it's worthwhile to repeat again, should that really be the first line treatment that people seriously consider?
I think it should. And I think it's, we talk about it. It used to be an optional extra. And I think now it's becoming more and more standard that um, more and more doctors are aware of it. More and more doctors now believe in the science and the clinical evidence behind it. And so it may not be the first thing they say, but
Yeah,
it's something that every patient should and must ask about, because if you can get, look, I love operating. It's how I make a living, and it's the reason I do what I love to operate. But not every operation is successful, and
yeah,
operations carry a risk of complications. And I know if I was going in to have a surgery and somebody said to me, look, there is a very good chance that we can treat your symptoms in a manner in which is both effective and safe, but avoid surgery, at least for several years.
right.
And the most important part about that is, number one, it'll do you no harm. And the outcomes of surgery, whether they're today or whether we wait a few years, will be roughly the same. Then I would take the option of not having surgery, knowing that I had a likelihood of getting back to the things that I love to do in terms of sports and just everyday life. So, yeah, I think more and more and more people should be asking this question. And it's not, if the doctors tells you, look, there's no good evidence for, for instance, for um, cervical spine degeneration or disc
Right.
disease and so forth, then that's fair, because there isn't great evidence in these areas. And
Uh-huh.
then you want to proceed with what's best, if it be surgery or not. But in the area of soft tissue injury, in the area of tendinopathies, in the area of joint destruction, and even bony healing, we know there's just simply overwhelming evidence now that regenerative medicine works.
Mhm.
And so consequently, as I said, in NYU, we're very, very proud of the work that we're doing in terms of making sure that whatever we use is verified, basic science, clinical evidence, and then the lanes in which it works best, because it won't work in everything. So we look at the lanes in which it works best, and that's what we're restricting it to. So getting back to your question, everybody should ask about it and be prepared that it may not be suitable for you, but at least you'll know about it. At least it's an option.
Exactly. And do you know whether or not do most insurance companies, including Medicare, even Medicaid, do they pay even a portion of the fee, or is this strictly going to be a treatment for the 1%?
That's it. Up to now, it very much has been almost like a boutique medicine type thing, because only it was not being covered by insurance companies. But as I said, more and more insurance companies are covering it, simply because they recognize that by contrast to surgery, it's far cheaper, and it
Right.
provides a bona fide treatment option that works with low risk. And
Uh-huh.
it's one of the things that we'll be actually talking to some of the leaders of the big insurance companies in July, once again to show there's an overwhelming amount of evidence, and it is getting bigger and bigger and bigger, and they simply can't be ignored.
No, that's great. Listen, it has been a pleasure and to be continued. As I said, I really want to write something, in my column in Dan's papers, because people really do need to hear
Yeah,
all of this. But I want to thank you so much for coming on the show. And as I say, the conversation will definitely be continued. And I know it is live right now, video right now. There's an archives where in fact I'll send you the link, or the producers will send you the link, where we can just continue to put this information out, for people to learn about, and so that they can educate themselves and, live their lives, as I say, in ways that are really in their best interest. So again, thank you so much. Say hi to Dr. Butler. Hi, James. And we'll definitely be in touch. Okay. Again, thank you so very much.
great privilege, honor. Thank you so much indeed.
Well, thank
Okay,
you.
bye.
So everybody, it is 3:57. An hour has come and gone, and I hope that you've gotten some really wonderful takeaway information from Dr. John Kennedy. Really, the more we learn, the more we educate ourselves, whether about it's relationships or sexuality or physical illness, the better we really are. So I want to again thank you so much for listening. And of course, your number one takeaway is to be reminding yourself to live your life in ways that are really in your best interest. And of course, secondarily, given the state of the world today, we all need to do a much, 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 much better job in learning to accept each other, differences and all, and hopefully get to a place where our society and world can become a much more loving and giving and compassionate world. So have a good rest of the day. Take good care of yourself in every way. And we'll talk next week. Goodbye, everybody.